before we get started, I want to differentiate between Botox and dermal fillers. The dermal filler we're going to be using today is Juvederm. It's made by Allergan. There are many on the market. Juvederm is nice because it's a very soft, natural product. A lot of people confuse the two. They call and schedule an appointment for Botox, and then they come in and tell me they want to fix this. So an easy way to remember is that Botox is mainly for the upper face, and fillers are used on the lower face. So we use Botox to correct lines that are caused by movement, by weakening the muscles that cause the movement. It's very safe. It's a purified protein that's made from the bacteria that causes botulism. And what it does is it weakens the muscles that you're using to make these expressions that make your lines. So for example, a lot of people complain about these lines because they create these expressions, they don't even realize they're doing it. So if you have Botox on board, you're not going to be making your angry face without knowing it. But it doesn't, another myth is that it makes you look like a mannequin, and that's not true. The way some people do it, you may, but the way we do it here, you still have expression in your face, and that's really important. Now with the fillers, you're going to fill in lines that are present without movement. So they basically just fill up the volume. And again, it's a very safe product. Juvederm is made from hyaluronic acid, which is present in your body anyways. So there's not an issue with allergic reactions. If you have severe allergies, like anaphylactic allergies, you do want to avoid any of these products. It's not recommended for you. Okay, so first I'm going to give Heather a little local anesthetic to make the procedure more comfortable for her. And while that's taking effect, we'll do her Botox. Okay? Just a little shaking to distract her. All right? So this is for her frown. So give me a frown. With me. Frown. Okay, and then we're going to get some of these horizontal lines here, as well as attacking her frown lines from above as well. So open your eyes for me. Botox comes in a powder form, and you have to dilute it with saline. I use a very small amount of saline, so my Botox is very concentrated. Therefore, I use less volume. So the little wheels, so to speak, are smaller. And I know Botox generally is $10 to $12 a unit this time. If you're seeing Botox for $8, $6, you want to be careful. There is a lot of Botox on the black market that, again, it's not Botox. So you want to make sure that the product you're buying is made by Allergan. Okay. It's been around for 17 years, and it's very safe. So it would take 18 vials of Botox to actually cause a critical illness, and that would be about $18,000. So, okay.
Thank you, Jen.
Now we'll move on to the filler. This is for Juvederm. We're going to start with the lips. I like to start with the border of the lips, which is called the vermilion border. And I like to be really conservative when I inject because you can always add more. The good thing about Juvederm, there is an enzyme that can dissolve it. So if you were injected with hyaluronic acid and you didn't like it, they can dissolve the product for you. Whereas some of the longer lasting fillers, once they're in, they're in. I try to get some of the product into the body of the lip with an entry point more at the inside to minimize bruising. But you do have to have realistic expectations and understand that anytime you stick needles in your skin, that could result in bruising. These are the nasolabial folds, which hers aren't really bad. And everybody has them, even my 5-year-old, but some people have them worse than others. Some people just really don't like theirs, so it's a very individual thing. So Heather just has hers in the very corner close to her nose, so we're just going to put a small amount of volume there. People get those a lot after weight loss because you lose fat volume in your cheeks and then it causes your skin to drop down. A lot of times when people do have skin sagging down because of fat loss, if you replace a little bit of volume up here, it'll pull the skin up, softening these nasolabial folds, and then you would require less product here to fill them. So again, just by putting a little product around this area, it would soften these lines and minimize what you need to use here. So, but today we're just doing Heather's nasolabial folds. Just have a teensy bit left. And it's very normal to have one side deeper than the other. I haven't seen anyone yet that didn't have that kind of asymmetry. So that's it.